talking age, specifically in the hands, so any excuse to play a bit of Bill Withers.
Grandma ain't clapped in church on Sunday morning. Grandma ain't played a tambourine so well.
Grandma's hands. I remember I was very, very close to my grandma, playing cards with her, sitting next to her and kind of pulling the skin up on the back of her hands and it becoming like a little game of how long it took for it to ping back to normal. And let's just say at the age of 41, I've started to notice my own hands are starting to take a little bit longer to ping back. And it is said you can often tell a person's age by looking at their hands, not their face. The reason is, well, we're finding out more from our guest, is apparently our hands age quicker than our faces. But why is that? And what can we do to prevent it? With us now is Dr. Robert Hierner, a consultant hand and plastic surgeon at Hand Vital Hospital here in Dubai. Welcome, Doctor. How are you?
Well, thank you, Helen. Thank you for having me on the show and giving me some opportunities to give you some information on a topic which is hardly known.
Well, that's what I was about to say. We haven't discussed this before. Interestingly, we are talking about feet later on in the show, but we've never really addressed hands, whether that is functionality, aging, which we're going to have a look at today. So do our hands age differently to the skin on our face?
No, they don't. But the hands and the face are, in most cultures, the locations that do show our age because they are exposed. Mm-hmm. And in the hand, it's the dorsum of the hand, which is much more important than the palm of the hand. And that is the reason why the jewelries are showing on the dorsum of the hand.
Mm-hmm. Can I ask you why you decided to specialize in this area? What is it about the hand that fascinates you medically?
Well, the hand is the region that makes us different from all other animals. Especially the thumb is what really gives you the opportunity to make a fine pinch, mm-hmm. to offer you a rose, not to make a power grip and handle from tree to tree.
Mm-hmm. So those fine motor skills. Interesting. Okay, so let's talk a little about aging. How does the natural aging process affect the appearance, as I said, my own grandma's hands, or maybe the functionality of our hands as well, Doctor?
Well, you see, the aging process is affecting on all the tissues. Mm-hmm. And make it as a very simple view on the topic is that the skin shows is for aesthetic.
Yeah.
And the other tissues like the tendon, the nerves, bone, and the joints are for function. Mm-hmm. In hand, it's very crucial to always to combine aesthetic and function. I can make you a very nice Madonna looking like hands stiff. Mm. This is not the aim we should do. Mm-hmm. So if you have a patient and they can come to you and asking you, what can you do for my aging hand, then you have to do an analysis. What part of the hand is the most striking? What is their skin and turn and end nerves? This is what makes the individual or hand consultation so important.
Tell us a little bit about some of the conditions you're treating or the procedures that you're performing there at Hand Vital, Doctor, in terms of, I didn't, forgive my ignorance, I didn't think hand plastic surgery was a thing unless it was reconstructive, unless there's been, skin grafting because of a burn. But in terms of the aesthetics, is this gaining in popularity?
Yes, it is. See, the skin procedures are exactly the same what we're doing in the face. So you're using fillers, you're using fat, your own fat, you're using lasers for color changes. What you probably do not use as much as in the face is the operation, like a lifting operation. This is very rare in the hand, mm-hmm. that you remove skin. Totally exception.
So what then affects the aging? And I'm saying this on a summer's day in Dubai. I'm guessing the sun plays a role, the environment.
Well, aging is caused by external and internal factors. Internal factors is genetic. So a good guess is if you have a patient and ask if it's a male, ask how the father's looking like, and if it's a female, how the mother's looking like. It gives you a good impression. And then there is those external factors, and a very important external factors are the sun, and is a chemical are products acting on the hand. So if you're a hairdresser or if you're a surgeon, we put on latex every day. This is very aggressive. So you have to moisturize your skin in order to prevent, to delay the aging process.
So did you see then something of a spike in interest in this post-COVID when we were hand washing and sanitizing so much?
Yeah, this was one of the downsides of sanitizing is good, but you know how to do it and how often you to do it. And when we do this in the hospital, we know that we have to repair the skin with moisturizing creams. This was not communicated. So we had a lot of eczema, so the dermatologists saw that because of too much of chemical products with a good intention.
Of course,
chemical products on the hand.
We've had a question here from Alex saying, does your doctor recommend sunscreen on your hands as well as moisturizer? Interesting. So there's been a big, and quite rightfully so, big push around wearing sunscreen every day, whether you are going, on your holidays or to the beach or not, getting up in the morning, having a little, splash of the face, sunscreen goes on. But back of the hand, should we add that to our list, doctor?
I think the hand and the face should be much more protected because those are the zones uncovered. If you have a shirt, you cover your trunk, you cover your arms, but you never have the dorsum of your hand covered, and you never have your face covered. So that's why it's a special interest to put sunscreen on that.
And just, what you'd be putting on your face, so, factor 50 doesn't really matter the type, or just whatever you've got to hand, so to speak?
There's no difference. Okay. You do the same. Factor 50 means you can stay in the sun 50 times longer than without. That's it.
Leanne, I love you for asking this question. Leanne says, whose hands does he like? Are there any celebrity hands that you think, oh, they're nice, or any that you'd love to get your hands on?
Well, let's put it the other way around. One of the celebrities who really shows or they're celebrities who have a nice facelift and who have horrible hands. And the most known is Madonna. Mm-hmm. And that's the reason why she's wearing gloves. I mean, it's like my grandmother did wear gloves, and for the same reason.
Interesting. So, what? Okay, let's go to Fantasyland. If Madonna was to walk into your clinic there at the hospital, what would or could you do for her? And I'm not saying to match the face because, my goodness, I think we've all got our limitations. But if people are really determined to make sure that they're, I guess, a bit more matching aesthetically, and we're going to talk about functionality in a minute, but aesthetically, what would you do if Madge walked in?
Well, the major changes in the aging hand on the skin are the skin spots, the aging spots. Mm-hmm. So that is a very easy procedure for laser. And the other major changes are volume changes. So your fat tissue goes away, and by doing so, your hands change the shape, and you see the tendon and the blood vessels much more through your skin. Mm-hmm. And this is the best corrected by your own fat. You take your own fat, you make a fat transfer, and this...
Choose where that fat comes from.
Well, you can choose wherever you take it from. If I can choose, there are regions where the fat is better, has better quality than others, but this is a detail,
How
but
interesting.
You don't need so much. You need 20 cc's per hand. You don't see this. The donor side is not, you don't do a liposuction to make a body contouring. You just remove fat for transfer.
Farouk is saying, I'm finding my hands becoming a little stiffer. I'm only 57 years old. Are there any exercises or supplements that can help maintain strength and flexibility? Great question. So functionality of hands. And as you said earlier, it is these fine motor skills that can affect day-to-day living, using cutlery, using a pen, the ability to work. So for Farouk and everyone else listening who would like to maintain that functionality as long as possible, what would you say?
Well, you have to keep moving. That is the secret. And to be able to keep moving, you just have to avoid having any pain. So if there is aging of the tendon, which is then a snapping finger or a tricking finger, you have to treat this so that patients are using the hands without having pain, without being afraid of moving it.
So I'm not saying, I'm thinking about, daily exercises we could be doing, which, I think most people listening today are like, I'm not going to be doing daily exercise in my hands. But, in terms of any exercise you could share now that you think might be beneficial if anyone is having some hand pain, anything that you do, how do you look after yours?
Well, the best thing is to put your hands in water. And the only thing you have to find out if you are a warm starter or cold starter, if you like warm water or cold water, because if the pain goes away or the stiffness goes away when putting the hand in cold water or in warm water. But that is one reason why my grandmother loved so much to doing the dishes.
Warm water.
Warm water.
How interesting. Doctor, thank you. We've run out of time, but really, really fascinating. As I said, you can be found at Adam Patel Hospital. Joining us in the studio now, we've had Dr. Robert Hierner, consultant hand and plastic surgeon. If you want his details, you can send me a high five. You can send me the word hand. We're very happy to share where you can find him. And we're going to be talking feet after 4 o'clock, podiatry clinic here live on the show. We are literally looking after you all the way through the afternoon and all over your body too. Dr. Robert, thank you so much for your time. Really appreciate it.